Good morning, everyone. Good morning. And welcome to anyone joining us online right now. My name is Carlo Martuscelli. I'm a health policy reporter with Politico. And today we will be discussing the EU's pharmaceutical strategy and the problem of industrial competitiveness. I'm joined here today by Stefan Wågström, Vice President for Europe and Canada at AstraZeneca, MEP Christian Buschoi, the chair of the ITRE committee, Florian Schmidt, Deputy Head of Unit for Medical Products and Innovation at DJ Sante, and MEP Nicolas Gonzalez Casares, who is also on the ITRE committee. Today we're going to be discussing a very pressing topic. It's the European pharmaceutical competitiveness landscape. European pharmaceutical companies are losing ground across a number of metrics to rivals in the US and increasingly China. The European Commission says that its reform will help make the business environment more attractive by cutting red tape. And Big Pharma says that actually it's going to hurt innovation. So we're going to get into all of that. But before we start, a few housekeeping remarks. First of all, you can ask questions through the Swap Card platform. If you're in the room, you can scan the QR codes on the screens, or you can check the instructions on our event website. We like debate, so please talk about us on X or the social media site of your choosing. Our hashtag is Politico Healthcare. Now for the discussion. Before diving in, I just wanted to start things off with one rapid-fire question, which is, setting aside the pharmaceutical package, in your opinion, what's the #1 obstacle facing European pharmaceutical companies? And just to give you some examples, I'm thinking of things like shortages of workers or maybe a lack of financing. And sorry, I'm just seeing Carl Nagler on the screen. He's a managing partner at Wellington Partners. Apologies, Carl, I skipped over you, but Carl is also joining us. So yes, Stefan, maybe we can start with you and then go around the room and then go to Carl.
Yes, it's a very big question, obviously. I think with the landscape today, with a fast-aging population, chronic diseases growing very quickly, getting access for new innovation and provide an environment where new innovation can quickly come to patients, because that's going to save a lot of burden for patients. I think that piece, making it attractive for innovative medicines to quickly come to patients. That's, I think, from my perspective, that's the most important thing.
That's kind of the pharma package, though.
Yeah. But it's true.
Okay, sure. Christian.
I think that maybe bureaucracy, red tape, the length of procedures in many member states. Of course, the pharma package is trying to address a little bit the situation at the EU level, a reform of European Medicines Agency, which performed well. They will have also the necessary financial means. We just finished the negotiations of European Medicines Agency fees. I was the rapporteur for ENVI, even that I'm the chair of ITRE, as you kindly presented me. So maybe the length and the red tape, and in some member states, like Central East European, I'm coming from Romania, also the lack of finance, you mentioned it, clearly it is an obstacle. Maybe the most important in some countries, in others, just the length of the procedures. And not enough flexibility, as we see in the United States, for instance. Of course, it's a long discussion about the different financing system, the level of investment, the different philosophy. But clearly, you can improve by improving the legislation, but also by improving the way that national authorities are taking decisions in many member states, even in the ones with good budgets, but long terms for making a decision.
Okay. So kind of the pharma package as well.
Yes.
Florian.
Yeah, I think the official Commission answer would also be there's not one answer to your question. But more personally, I would say what I think, you have to start early if you want to make a difference. So certainly we have to maintain and keep clinical trials in Europe because they are often an important trigger then for subsequent developments and access and availability of products in Europe.
Okay, clinical trials, interesting. Nicholas?
First, thank you. I have a complaint. I have a complaint because we are all men. So I think it's very important to mention this, the gender balance. Sorry for that, but it's not a complaint to Politico, it's a complaint, a general complaint that we should acknowledge. Let me say one thing. I think the same as you did. We don't have only one answer. And I don't think that the pharma package is going to solve everything, because we have a problem of lack of financing, we have a problem of bureaucracy in member states, but also we have a problem of fair competition. Trade is important, international trade. So there are other blocks, mainly China or India, that are putting a lot of money in this unbalance the level playing field. And I think this is very important to mention. Now, how to address this is not only in the pharma package that we can do it.
Okay, the trade point is really interesting. I hadn't heard that one brought up before, so that's definitely one we'll return to. But before we do that, Carl, if you also want to weigh in.
Yes, so I think there needs to be a lot of focus on these small, innovative companies and on the ecosystem that they need to thrive. We are already behind. We all know that significantly more investment is going into US startups in the biomedical field, that there's more talent, that there's deeper pools of capital and so on. So we really need to make extra efforts to create a thriving ecosystem here, because this is where the innovation is coming from. More than half of the drugs that are sold and will be sold by pharma are coming from young innovative companies that are licensed and in or acquired. So we are there more and more falling behind, and even more so, innovation that has been started in Europe is being drained into the US because it is acquired by American companies. And then maybe talk further later about the package. I will make the point that some of the elements there will unfortunately drive that more into that direction eventually.
Okay. Great. Thanks so much for your answer, Carl. We'll be returning to the point of financing later in the discussion, but I wanted to kick things off with a question to our two MEPs here today. Given that the pharma package is now in the European Parliament, we have reports from both of the rapporteurs on the directive and the regulation. I wanted to ask you both, what is the role of ITRE in these negotiations, and what do you see as the upcoming political discussions, and do you see a possible political agreement before the end of this European Parliament? So maybe, Christian, we can start with you, and then we can go to Nicholas.
ITRE decided to provide opinions for both.
Sorry, ITRE is the Industry Committee.
Research and Energy Committee of the European Parliament. Before that, you know that there is a fight between committees for competencies, and I try to get to ITRE some competencies exclusive or even shared, also on the market protection, on the issues related to IP. I was not successful, and I understood the decision of the CCC and of the Conference of Presidents.
What's the CCC? Sorry.
The Conference of Committee Chairs. When we have conflicts between two committees, we try first to negotiate. Was difficult with Pascal Canfin, of course. It's difficult with me also when I have to protect the ITRE competencies. Then, of course, we went to arbitrage. It was discussed in CCC. Of course, the services prepared the ground, and then a formal decision was taken by COP. So we have some prerogatives, Rule 57 shared on some limited, like the role of SMEs, the cybersecurity, which is a competence of European Medicine Agency system and so on. But despite this, we decided in ITRE committee to provide, and we'll address the whole legislation coming from the angle of industry, of competitiveness. Of course, I'm sure that amendments will be tabled also looking to other aspects, but I asked the rapporteurs and the teams to concentrate on the industrial point of view and competitiveness point of view. And I'm waiting the results. The political groups just decided the teams in charge with this. And of course, me and Nico, we are both members of ENVI also, and we work together on the new role of European Medicine Agency after the pandemics and many other files. So we are, many of us from ITRE committee, we are actively following or involved in ENVI debates.
And just to make this clear, you're from two different political groups, yes. But on this issue you see eye to eye, or what are the divergences here? Maybe, Nicholas, we can go over to you on that point.
Let me say that nobody can explain better than Christian this conflict of competences. He's the chair and it's very well explained, so I didn't come back to this. But regarding the difference between groups, it's clear that we have...
sorry, what group are you with?
I'm
just
from
to
the
make...
Socialists, to be clear, and the Socialist, Social Democrat group, and Christian is from the EPP, Popular group. So we don't have big difference. But I mean, in the ENVI committee, we have seen a proposal in the directive that is going beyond the proposal of the Commission when it comes to the intellectual property and so on. So I think this could be one of the main discussions and the main conflicts or divergences between groups.
The IP question.
The IP question. I will be involved in the ITRE committee, and also...
Your shadow on the regulation for the S&D, is that right?
Probably we will change, because
okay.
I will be shadow for the directive in the ITRE committee, okay. And probably I will be shadow on the ENVI committee for the directive also.
Okay, well that's some news right there.
So I will have, as Christian said, one foot in one committee and the other. So the side of the industry, but also the side of the health. For me, the health approach, the public health approach is also very important, because we cannot forget that our member states are spending a lot of money on these issues. Medicines are sometimes, not always, sometimes expensive, and we are having a lot of shortage, for example, in Europe. So the public access is also very important when it comes to this legislation.
Okay, so we have some exciting discussions coming up, is what I'm hearing. Florian, I wanted to ask you, the Commission's proposal, I think it's fair to say, hasn't been well received by the industry, but the Commission does maintain that actually there's a lot there to help companies, cutting red tape, for example, which was mentioned as one of the obstacles right at the start of the discussion. So, Florian, in your view, what does this package do for the industry? What are the pro-competitiveness measures?
No, you are fully right. When it comes to innovation, we hear a lot of discussion about our proposed modulation of incentives, but this is not the whole story of this legislative package. And let me mention three things. I mean, what we are proposing here is a better situation prior to authorization. We did a lot. Obviously, this package is dealing with the authorization of medicines, has a limited scope, but we can do better before a company files an application by giving more scientific advice to companies, and also combine scientific advice for more complex products, because we see there certainly a problem.
And this helps companies by, it allows them to go through the process quicker, or?
Because if you come early to the regulators, you have, in a way, it's de-risking your strategy,
Sure.
because you can engage, you can test, and if you bring at this early stage also different authorities that are responsible for different systems together, companies can get a combined answer if they combine, for example, medical devices and medicinal products, and that will help so to delete this silo mentality. And certainly we also propose a major reform of the European Medicines Agency. that will make the authorization process more agile, more quick, and more responsive.
And you're eliminating some committees, right? You're streamlining the agency.
Okay. We are deleting some of the committees because some of the most complex products, ATMPs, today have to deal with 5 different committees if they are also often medicines. And in future, we have the main committee and the safety committee dealing with it. That will simplify. And another point is that we are opening the legislation more to digitalization, real-world evidence. And maybe a final point, we also introduced what we call regulatory sandbox. That is an instrument which is used currently only in the financial services, in IT service, to test before something is fully regulated, under the control of regulators, new innovation, to get accustomed to innovation and make also innovation help them to come to the market.
So the idea would be you can test some flexibility before really rolling it out, and hopefully you can find ways to speed up the process.
Correct, because currently the problem of the legislator is we cannot have no crystal ball for the future. And this will help to test something, what is the best regulatory approach to some new innovation, then have the information, and then finalize the regulatory framework.
Stefan, up until now, we've been neck deep in the politics and the policy, but I wanted to take a step back for a second and look at Europe's industrial landscape and how it's evolved over time in the past 20 years when it comes to pharmaceuticals, because I know the industry has raised this point that there's some warning lights flashing when it comes to Europe's pharmaceutical sector, across a number of measures. So I was hoping you could maybe talk us through some of those, and then I could also ask you about the industry's concerns when it comes to the package.
Yeah, thank you. But if you take a look at this new proposal, and actually the intentional proposals to increase faster access for medicines and more equitable access for medicines to patients is a good initiative. We also think it's very good to raise Europe's competitiveness, which is absolutely needed, right? So that piece is very good. We're also, like Florian talked about, there are some improvements actually in the regulatory part that we shorten the regulatory timelines, positive. But if you look at the totality of this package, we actually think it will discourage further investments in research and development, for example, in Europe. But there will be less clinical trials, which we said was very important, and also the fact that when we establish clinical trials, we also make the connection and the ecosystem between academia, healthcare, and pharmaceutical companies to improve the whole healthcare. These things are critically important. So if you start reducing the regulatory data protection, that actually is going against what we want to do. We also need to look at what has happened in the last 20 years. When investments in research and development in EU has gone down with 25% over the last 20 years. We also see, and that's very important, that new breakthroughs in medicines, so new medicines coming to market. Europe used to be 50% of world's new medicines. Now it's only 20%. So that's a big shift also during these 20 years. And clinical trials are half of what we have in the US. But it's 1/3 of China, for example.
But this decline we're seeing, this happened under the current framework. So clearly data protection doesn't explain it because that's stayed the same in the past 10 years. So, Kate, what's the link between data protection and competitiveness here? Because you could imagine, for example, that Europe reduces its data protection, but you still have great companies inventing products sold in the US, sold in China, sold in Japan. How do you see the link between data protection and then
if you look
R&D
back,
investment?
if you look back in the last 20 years, for example, you have small molecules. We've seen the IP protection, so the the IP protection, the patent has been usually longer than the data protection. So they've been protected during this time. But if you look now, innovation is extremely hard to get. We have good medicines, but we're aiming for those new innovations and breakthroughs. It takes time to get those medicines to market, which means that the IP protection, when we enter the market, is very short, and the regulatory data protection then becomes more important. So that's, if you aim forward, and if you then think a little bit about the new type of medicines that we will have, gene therapy, cell therapy, but it's absolutely more complicated to get a patent for those. Sometimes you can, sometimes you're not, and the patents are not very strong. So the reliance on the data protection just increases. So when we're making investments now in clinical trials, building up the collaboration with healthcare system, academia, etc., it's a long-term investment. It's for the next 20 years, the coming medicines. And that's why the regulatory data protection connection to investments becomes very important. I hope I was clear on that.
Yeah. Carl, can I add to that?
Absolutely. Carl, jump in, yes.
Yes, because I think just to connect some dots, when I invest into a young
sorry,
company...
Carl, do you mind just explaining the work you do first, just to provide some context,
absolutely.
And then...
So I'm a venture capitalist, so we invest into biopharma companies that have early stage projects, preclinical or clinical stage projects. And when we invest into those companies, of course, we need to consider what is the market opportunity. It's a very risky project. We have a lot of expenses before the product might get approved, many risks. But then, of course, we have to very carefully look at what is the market opportunity and where is it. And already today, for many biopharma markets, opportunities, the opportunities in the US. We always have to look at the US market. There's better prices paid. It's easier to distribute in the US as compared to Europe, which is more fragmented, as we all know. So now if we then build the companies, where do we install management? Is the chief commercial officer going to be in Europe or in the US? Well, very often we end up building the senior management team in the US because that's where the market opportunity ends up being. So if we now look at the package, a reduction of the market exclusivity, impacting in particular small companies that will never ever be able to, within a few years launch in 27 member states, I will have a significant reduction of the market exclusivity. That shifts the issue even further. So, Carlo, I think the point is that it's not perfect today. It cannot mean that it can get much worse. So I will then look even more at the US opportunity, which will lead to management being in the US, the US market being developed first, the FDA calling the shots about how I develop the drug, and a US acquirer being the most likely exit route for us, rather than building a sustainable lighthouse company in Europe that will become even more important. So my assumption is that these types of changes, which seem minute, they just shift the balance more into the direction where things are unfortunately already going.
Stefan, I'll let you jump in, but just to make sure we're understanding the point here correctly, you're saying that the management and the businesses, the company's whole structure will be located in their most favorable market, something like that. Is that
yes,
right?
For commercial stage opportunities, of course. Why should I install a management in Munich if the market opportunity is in the US? And that all adds to the issue of brain drain and innovation drain out of Europe.
Stefan, I'll let you jump
Just to make it crystal clear from my side, if you look at, if you have 6 years of now proposed regulatory data protection, and if you enter the market with the market authorization, you have 6 years. It takes 2 years sometimes to get reimbursement, so you reach patients. And then you have only 4 years left of protection of your innovation. It's absolutely too short. And to do all these investments in clinical trials and establish research and development in Europe in that landscape, I think everyone can understand that is a very high risk.
Florian, I wanted to let you jump in because there's been some criticism, and I wanted to let you, first of all, defend the package, but also I know that this discussion is about the pharmaceutical package, but I also know that the Commission has many DGs, that you try and take a holistic view of the industry. I know that there's a biotech plan for Q1 of next year. So, Florian, how do you see this issue, both of data protection, but also maybe some of the other problems that are affecting European industry more generally?
Yeah, generally speaking, from our perspective, innovation is more than just the data protection length. There are much more elements, and I like the term ecosystem that plays a role for investment. And I can just recall that on the same day we presented the pharma package, we also have presented a new proposal for unitary patent system and unitary protection certificates, which helps a protection system which builds also, or which also protects.
And this is something the branded pharmaceutical industry likes, because it means that they just have one patent to protect, not 27 in different member countries.
But we should also not forget that we have a political problem here in Europe, that the access to medicines, to innovative medicines, is not equal in Europe.
Sure.
The statistics are very clear that new innovative medicines makes it very quick to some member states, but there are other member states which see the product only after certain years. And what we can do with this package is to make a contribution to make it faster, the access in member states. Obviously, it needs also a change of behavior of member states.
Sure.
It's not only the companies that have to change, it's also the member states that have to buy in the solution, so to make it more accessible. And then in the end, the protection period can even be longer than today.
Yeah, and just to provide some context there, we're not talking about a blanket cut to data protection. There is the possibility that you can get some or all of that time back if you meet certain criteria. The industry will say, it's impossible to launch in all 27 in 2 years, but I guess the package is trying to get people sitting around the table to work on that issue. I did want to go back to our MEPs just to respond to some of the points raised, because now it's up to you in the Parliament, in ITRE, in ENVI, which is the Health Committee, to maybe take on some of these criticisms or to change, to make certain changes. Nicholas, maybe we can start with you, because your colleague Timo Volken is dealing with the regulation. I mean, how do you see this criticism about the data protection? And I know the S&D is probably more sympathetic to the Commission's point of view than the industry, but maybe not necessarily. So please.
We are close to the Commission proposal, but it's not our proposal as it is, because we have some difference. But let me be clear. I think that we have to say to the people that is remove some ideas, because the data protection and the incentives are not always linked to the localization of the industrial production.
Yeah.
Because one product that is designed or be in the market outside the EU has the same incentives that others made in the EU. So we can discuss, for example, if the reduction of the regulatory data protection will make the pharma industry invest less in R&D. This is true. This is one of the things that we have to discuss. But for me, data protection is not the thing that is going to solve this unfair competition that we are having around the world.
And who are you speaking about when you say unfair competition?
I mean, it's true that we have...
Let's name some names.
No, we can put names, but the reality is that we have different standards regarding also data protection and the access to data of the patients with other blocks, the environmental standards. There are different issues that are not the same in Europe than in other blocks.
China.
Can be, don't put names. But in any case, we have to work together for a better balance with the industry. I think that Commission have some good proposals. They are using a carrot and a stick. Sometimes I don't think it's the best way to do it, but we can manage this in the Parliament, in the debate and the discussions. And let me remind one thing. At the starting of this commission, we had some problems, industrial problems regarding the production in Europe, in chips, batteries, or elements for the green transition. And also in medicines, in the industrial production of medicines. And the Commission acknowledged that. And it's very clear in the statements of the President of the Commission. But now we have regulations in place to support investment in all these fields, but no in the medicines field. So I think that we have an opportunity, not now, but probably in the next Commission, to push for that. Because I think we need clear support for R&D, but this clear support is not going to be solved only with the pharma legislation. We need other kind of incentives. And also we have to work in order to break this fragmentation of the internal market. I think this can be done in this regulation. We can break some barriers. And to answer him, they are investing a lot in US. You said there's a better environment, but let me be clear, let me be honest from my side. In my region, people live more years than in every state of USA. And this is also, I think, is also linked to the public access to the health system, not only to medicines. Yep. So I want to raise an European flag regarding our public health systems that we have to defend.
Christian, I wanted to let you respond, or at least put your point from the EPP. I know that Pernil Weiss, who's the rapporteur for the directive, has taken a very divergent stance from the Commission, totally erasing a lot of these modulations of incentives in her draft report. So is a deal possible between the EPP and the S&D on this point, just given how far apart you seem?
No, it should be possible, and it should happen. Of course, in the end, we have to find the right balance. It is challenging to finish by the end of this term. Probably the discussions will continue. It's not necessarily bad, because we are now establishing a framework that will last several years, and we need to take the proper time. Also, the legislation is quite complex in terms also of numbers of provisions and articles. Of course, this could be the most contentious issue, the data protection and the incentives. Personally, I'm also sympathetic to European Commission proposal, but clearly maybe it's not enough to boost innovation. And we discussed in EPP, my colleague came with a proposal that could be negotiated in the end, but at least it's a strong signal towards innovation. Clearly, it's not enough to reduce dependencies, to gain strategic autonomy, to be prepared in case of shortages or even geopolitical events. We need also to give the right incentives to generic industry to increase the number of production facilities in some member states. Maybe some clear, maybe not state aid, but some clear fiscal or economic incentives, and not only, of course, to generics, to base. Also, if we can produce more and more innovative medicines in Europe, it will be extraordinary. But here is the discussion about the access to innovation of patients and how the innovation could be brought back to Europe, or at least not to lose very bad global competition. Mm-hmm. And here what Pernil did is a good starting point to maybe discuss a little bit that we need stronger incentives for innovation. But finally, clearly, we need to find a common point. And also the negotiations between the two main political groups will have to take into account that we need to find clear solutions. That's why the input from industry is very important. It is good to understand the realities. Clearly, we need something strong. It's not enough just to give some, because the situation will not change. And we'll meet in POLITICO summit in few years, maybe, and no. Maybe we'll be disappointed that despite the fact that we did this, that we made this work, that we really made some efforts, if we are not clear enough and holistic enough, it's not just a legislation, many other things that we should do. The pharma strategy is also addressing some of the national challenges. We need a proper finance once again. It's not enough with companies or industry money. We need to be much more ambitious.
On this point of financing, I just wanted to let Carl jump in real fast, and then we can go back to you, Nicholas, which is just, we've been speaking about the pharmaceutical package most of this time, but I know that there's also an issue of financing for European companies, that the US just has much more sophisticated investment banks. They have more venture capital. So I wanted to ask you, Carl, what do you make of this issue of financing? Is this one of the missing pieces to having more competitiveness in Europe? And also, if the EIB has any role, the European Investment Bank.
Yes. So first of all, the magnitude of the issue very quickly. I mean, I just looked at the most recent numbers. First half of this year, biopharma investments of VCs globally, US, Europe, 10 billion roughly. Versus 100 US Europe versus 180 million in Europe. So that's about 17%. So of course, many things are bigger on the other side of the pond, but we are not 17% of the US in terms of population or GDP. I mean, this is just distorted. Germany particularly bad. Carl, you remember the number of 1/7 of investment in healthcare startups as compared to the US after normalizing for the GDP. So, and this, although we have great science, in terms of patent output, you don't see those strong differences, but it's really the translational bit, those innovations then, leading to startups and those startups then becoming successful, not being snapped up too early by often US strategics. That's what we have to work on. Yeah? And I know that this is high on the agenda of the EIF and EIB. I think there's a good program of the EIB. They have a venture debt program where they invest 500 million per year alone in life sciences. And these are larger financings, 20 to 50 million, with the aim to support more advanced projects to allow them, to continue standalone and not having to be merged or acquired. And the EIF, there's this Tech Champion initiative, again, with the intent to have companies scale. So that is an equity fund of fund provided to players, hopefully like us or others, that can support companies with large financings in order to, again, allow them to not having to look at US capital markets and or acquire this too early. So there are initiatives, but again, the magnitude, 10 billion first half of this year, 70% of that in Europe. Is a Tech Champion initiative with 3.75 billion right now. The question is whether it's enough. Is it bold enough? But I think it's the right direction. People always ask for more, but my fear is that one really needs to recognize that health, innovation, advanced therapies. This is going to be the future for all of us, and will significantly, as was said, have an impact on reducing cost eventually if we get the right advanced therapies.
Thank you, Carl.
On the market. Yeah.
We're at the end of our time, but Nicholas, I did say that I did want to give you a minute to respond really quickly because you had a point to make, and then we have to.
Some points that were touched by Christian before. I think that we are in a process of discussion and debate, but I don't want to blame Commission, but I have to say very clearly that we have two failed launches of this legislation. So
we have two what, sorry?
The proposal was scheduled to be launched
right, the
twice.
delays, yes, yeah.
And they have a big delay. So the problem now we are having in the legislative process is that we don't have enough time. And the problem of time is on the table, because we can finalize or we can have a political agreement, but if we don't vote before the end of this legislature, that for me is almost impossible, in the next term, we can have new problems or new processes regarding this situation. So if we had a proposal 1 year ago, for sure we will finalize during this term. So it's not a problem from the Parliament. So it's an advice, don't blame the Parliament on this.
Well, on that note, we'll wrap up our panel. We have run out of time, like how the European Parliament possibly will run out this term. But thanks so much for the really interesting discussion. Clearly, there's a lot of moving parts to this. It's intellectual property. It's also financing, jobs. There's a lot there. Our next session is going to be with, sorry, I just closed my page. It's going to be with Stefan Ulrich, head of Bayer, and my colleague Helen Collis. It'll be a pre-recorded interview, so please stay in your seat, and thank you all so much for joining me today.
Thank you.